happening, well,
Oh, wait.
We already know what it is.
We know the
okay.
process.
It is Tuesday, October 19, 2021. We'll call the meeting to order. Please stand for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
One and one.
Minutes and reports received and filed.
Yes, we have the collector's September 2021 fees and the treasurer's September 2021 reconciliation report.
Okay, Commissioner Committee liaison reports, upcoming meetings and events.
All right, we got Salary Commission meeting this afternoon, Chamber Transportation Committee meeting tomorrow morning. We got an event Thursday night for Special Olympics, Denim and Diamonds. Then that's about it till next week.
The County Commissioners Association Missouri meeting is on Thursday in California, Montauk.
Montauk, yeah.
And I think we all three declined originally. I had a conflict with Port Authority, but the Port Authority meeting's been canceled, so I'm going to see if I can still get in on that
Oh,
meeting
okay,
on
good.
Thursday. And next Monday, the 25th, early in the morning, or 8 a.m., is KWAS. I'm visiting with Austin and Marsh.
Should we phone in?
Sure.
Yeah.
Aren't you on there once in a while too, Sam?
Yeah, I was,
Okay.
yeah. Remember.
Oh, yeah.
Okay. Yeah, and tomorrow we've got flu shots here from 9 to 10:30, so that's important. I got lunch with Stars and Stripes Museum. Friday night is a Public Schools Foundation Gala. And that's all I've got this week. Before we go into commission comments, I want to introduce our new Emergency Management Director, Nick Tetzart. Tetzart.
Yes, sir.
Welcome.
Thank you
He's
very much.
second day with us, so we'll be kind to you for at least a week.
I appreciate
Yeah.
that. We.
Well, he started Monday, so next week. yeah. Okay, any commission comments? Bids and contracts. Signing of the cafeteria plan agreement with Health Equity.
We were with WageWorks, and basically they just got bought out by Health Equity. So I just need a new contract signed, and it's for 2022.
Good.
I have a motion to sign the health equity contract for 2022, effective 1/1/2022.
Second.
All in favor?
Aye.
Okay. Elliott Data Service Agreement Renewal.
So this is the badge system that we use to create all of our department IDs. It was originally purchased through a grant that Sierra Thomas was working on. Bill notified me a couple of weeks ago that that grant was no longer available to us. So we looked at this. It is still a need. We are still using it. We went back and really evaluated what the system was designed for and what we're using it for. We decided not to continue with some of the other features on it. We got it down to $1,300, which fits well within my contract's budget for this year. So we were just going to pay it, but I sent it to Jill, and since there's some terms and conditions, we felt that we should present it to you guys to get permission as we move forward. So asking that you sign this today so that we can renew this agreement for our badging system.
The magnetic badges to get
Your
get
turn,
out of the
your turn.
doors, so
Correct.
we don't use the same ones we have up here.
It's this system here.
Oh, it just makes a badge, it's not to get inside the door, is it?
There is a magnetic component within the badging, I believe itself, so.
It comes already on the badge, they just have to tell it what access you get. So the badge
A little
has
different
the
than the ones-
magnetic in it, and then their printer prints on the badge.
Cause that's using my regular badge to get in and out the doors, that's why I was wondering why it was different than what we have up here.
I think same thing, just a different printer.
Yeah, I think it was actually originally purchased a long time ago with Public Health Emergency Preparedness Funds.
Yep.
And it was purchased in case we ever had to issue cards for volunteers. So, and then other departments started using it, so, and I
So-
don't know why it's different. And then they started
Okay.
buying cards that had
So it's not even just the magnetic cards, these are the badges for our
Yeah.
other emergency services
Right.
stuff.
Correct.
Yeah, because I got the other one too like
We
that,
print
so.
these badges that have like names and titles and pictures on there, so if we had to, you know, have a big event and needed
Well, if you're at an
volunteers-
EOC, then you can look
Right.
at the colors and associate them with
And that's
that,
why it's
so.
portable, is
Okay.
you could take it to a site.
Okay, I didn't mean to get that deep into it.
That's okay.
Well, while you brought that up, we do have a problem with our badging system here, not so much as the cards themselves. We have to buy the cards that go with the door access readers, because the readers, some of them are the original ones, and they came from Sonotro, so we have to buy the cards back from Sonotro. So it's become very hard to get the cards. So we may need to look at that in the future to update our door access and get our own system like this, or add on to their system somehow.
Yeah, they're prettier cards than our cards. Our
that
cards
too.
are just boring.
The fire departments use it also.
Yes,
Okay,
correct.
Okay.
Yeah.
So we may need to update ours at some
There you
point.
go, Nick, that's your first job. Find us some more money. This is a small one.
To talk to him about.
Add it to the list. There you go.
aren't you
Okay.
glad you're here today? Wait till we get done with.
So
Okay.
is Donnie aware of the other issue with the cards?
Yes.
Okay. Great, more stuff.
Mhm.
Okay. I make a motion to sign the service agreement invoice with Elliott Data Systems.
Second.
All in favor?
Aye.
Aye. Okay, Wic Services Contract Renewal.
That's fine. I was thinking about the badging system, sorry, I was on a mission.
Oh, you had your time.
I'm done, okay. So it is the annual renewal of the Wic contract. As you know, we see about 1,500 Wic clients a month through the health department, and it brings it over $1 million to the Cole County grocery store. So it's just time to renew that contract with DHSS.
I'm good with renewal.
Christie, does the 1,500, is that a growing number, a constant number, a declining number?
We've been pretty steady for the last few years. COVID changed it just because they had a waiver where we could do a lot of things where they didn't have to bring their kids into the office, but it's still pretty constant. You know, you can get WIC in any county of residence. You don't, or any county, it doesn't have to be your county of residence. So because we have WIC services every day of the week, we do see a lot of clients from other counties, but we are paid for the number of clients that we see. So.
Okay. I make a motion to renew the WIC service contract.
Second.
All in favor?
Aye.
Aye.
Aye. Okay. Signing of corrected contract for the industrial laundry equipment.
Last week I had this on the agenda to be signed, and I didn't have the warranty amount on the quote, so this is just an updated contract with that warranty amount on there. So the total is gonna be $27,695. It's for RJ Cool for the Sheriff's Department.
Good. All right, make a motion, we sign the amended contract for the industrial laundry equipment with RJ Cool.
Second.
All in favor?
Aye.
Aye. Okay. Do we have any unfinished business? New-
Well, quickly, Chief Hoy, do you care to update us on the progress of the ambulance search?
Thank you. So yesterday we went and did did an on-site visit to Osage Industries, evaluated their product and met with their representatives. So we've now met with 3 different dealers, so to speak, of ambulances from our local footprint. At this point in time, we're moving on to the phase of the project where we're going to look for building our specs or what the blueprints of the ambulances would be. That's going to be a cooperative process with our people and of course with you 3 gentlemen as well. And once we kind of have those specs put out to bid or built, we can move into kind of the bid process and see what that looks like. The unfortunate thing is everybody that we've met with has given us at least an 8-month turnaround time. So from our perspective, this is something that we should probably look at getting done sooner rather than later. I know there's a lot of hoops to jump through, but with the turnaround time and the nature of the world right now, it's not something that I feel that we can drag our feet on. So, any other questions, comments, concerns?
I just thought the other folks in the room and on should know what's going on here. That I like you said, our footprint. We're looking inside our footprint to make this happen.
Correct. Yeah. So the folks that we have met with are all people that are our local dealership representatives that represent the different brands of ambulances. So they are local businesses within our footprint that we're looking at dealing with. So.
Thanks.
Okay,
And different types of ambulances too.
yeah,
Correct.
And then one of them was a manufacturer, a dealer for Demir's ambulances, which we do have some, so.
Yep. So those three dealerships actually represent 6 different ambulance lines. So we have done our due diligence, I think, and now it just really comes down to what provides us the best product for our needs. And I think as we've had these conversations, we're looking maybe at a different type of ambulance, one that's more of a truck chassis than as opposed to the van chassis as we've talked about in the past. But as we move into the spec phase, those are all conversations that will get cleaned up and produce a final set of plans that we're looking for to go out for RFP.
Okay.
yeah. Okay, and kind of piggyback onto that discussion of Cdbg grant to build EMS substation. We have Lincoln Brown, regional planner and grant administrator for the Mid-Mo Region Planning Committee, and then Rachel Senzi with Jefferson City. So we've been kind of, I've been looking for money for probably a couple of years, trying to find grant money to build an EMS station north of Highway 50, because I think a lot of your call volume is in this area. And we've been staging an ambulance in the jail, but that's just kind of a stopgap. And then you've been staging ambulances in parking lots and strip malls, and people call up and go, "Your ambulances are goofing off." I said, "No, they're not. They're there so they can make a quicker response when a call comes in." So that's what we're looking at. So
Yeah, so I'll just provide the background. So in the month and a half or so that I've been here, evaluating our operations, one of the primary needs that I have seen is trying to find a permanent home for an ambulance downtown. Currently, our ambulance is stationed in the jail Sallyport due to the gracious nature of Sheriff Wheeler over here. That is a great temporary fix. It allows us to put an ambulance downtown in a county-owned building that controls our cost. However, due to the operations of the jail and the correctional facility in and of itself, that presents some challenges sometimes when there's inmates or movement in and around the jail itself. So it's not an ideal location. The other thing that we've done is we've looked at our call data. The calls produced in the downtown corridor, so to speak, are higher than any other area in our coverage area. So currently we're averaging about 10 calls a day for the station for the ambulance out of the jail, which is pretty much double our other ambulance locations. That tells me that we have a need to put a second ambulance downtown. Unfortunately, due to our current configuration and operations, we don't have a space to do that. So by exploring the options of building a station downtown, it would allow us to increase our effectiveness to respond to calls down here and kind of offload that crew that stays down here for that 12-hour period. So it's a need. It would allow us to better deploy our resources, and it would allow the sheriff to have his building back and not have us, jointly operating there. So plenty of benefits to be had.
Do you want to speak a little bit about what we, yeah, it's, I think it's a great opportunity, and what we would do is we would kind of piggyback with the city of Jefferson to apply for the grant, but,
Sure. Rachel Senzi, City of Jefferson. This funding, Community Development Block Grant, normally the City of Jefferson is considered an entitlement community, so we get a direct formula grant from HUD every year. It's usually about $300,000. With CARES Act, it opened up a funding opportunity through the state of Missouri. So the City of Jefferson is applying for a maximum of $2 million, and then Cole County was also eligible. So we had sent the funding opportunity to Sierra Thomas at the time and said, I know you were looking for an ambulance facility, this may be it. What we didn't know was the nuances of how that's going to work, because the state is not used to the city applying, and so we needed to figure out if we could both apply, which we found out the answer to that was yes. However, because of where the project location is at, the City of Jefferson has to be the lead applicant for Cole County, which at a staff level, we all agree that we need an EMS substation. We agree with the project conceptually. Now we just have to get the bullet points in an intergovernmental agency agreement together in order to make that happen. And that's really where we're at. So the overall, conceptually, the RPC would be building out your application, and then the city, hopefully once it gets funded, then the city would be responsible for the oversight of the activities of the grant.
yeah, I think we've kind of narrowed it down to a site, and I think the next thing we have to do, when we have to submit architectural drawings, designs with the application, so we've got to keep moving on that, because that could take some time in itself, so.
Yeah, some of the urgency on this, just for everybody here, is the fact that this is a pot of money that's, it's tied to the COVID pandemic, and it's a rolling application cycle, so it's kind of first come, first serve at the funds, and there's limited funds available for these kinds of projects.
So you said the city can apply for 2 million or up to 2 million, and the county can apply for up to 2 million. So where would we be able to apply for other stuff for the county?
For
That's
COVID,
outside of city limits, any incorporated area, or?
so there's a couple different things. Yeah, so Cdbg has different pots of money that are tied to different appropriations bills. The pot of money that we're talking about is specifically for COVID. If you're talking about utilizing $2 million for this particular project for an EMS substation, you would be tapped out on how much you could ask for other projects. But there are other Cdbg funding sources that you could go after money for. They have the normal community facilities, public infrastructure. I think I've actually talked to your public works people about a stormwater project. I think they were trying to do an income survey to see if we could actually get that area designated as low to moderate income, so they could get money for that. So it doesn't inhibit you from applying for other pots of money from Cdbg in and around the county.
So there's not 2 million for us and 2 million for them being Jefferson
It
City?
could be $2 million for, yes, there is.
Yeah, no, there is, because I think as Cdbg described it, their application for their project would be one application, and it's strictly a Jefferson City project. And then this project is a joint application, so they would still be lead applicant, but you signing on as a multi-jurisdictional application changes that, which means it allows you access to an additional $2 million.
But
For your
your
project.
other local municipalities could apply.
Yeah.
So if you had, within the county, you had your
Okay.
smaller towns could do it.
So we'll give this to Nick, and here's another, 2 days, and,
Thanks, Sam,
But-
because I didn't want to be that.
but there is an
guy.
application here and everything, so I'll pass this on to you.
That'd be a
But
good way for you to
I
get
think
some of
this
our
is
small
just-
community people.
I think this is something we've got to just get moving on. I know you had said that you could, as far as covering an architect to do this, it would probably be quicker for us just to do it ourselves and pay for the cost. And because as you said, there's only a finite amount of money, and first, the early bird catches the worm. It's going to take a while, I think, to do those designs. And
Talking about some of the next steps, one of the things that I've had through other conversations regarding this project is there seems to be a push for the intergovernmental agreement, the IGA, since the city is going to be the lead applicant since the project is occurring in the city. So I think to move forward, the ask is that we come to an agreement between the two governmental agencies that we are going to pursue this project and understanding what the roles and responsibilities look like so that everybody is comfortable. The other nice thing about this project is that if we do get this grant pot of money, it does allow us to look at some of the other operational needs of our department, and also in having conversations with our other public safety agencies of some flexibility on what projects could happen down the road, since we would be saving this money on building the station downtown. So it is not just a joint or a benefit to the county and my agency, it would really be a benefit to the entire Jeff City, Cole County Public Safety Consortium. So it is a much needed project, and if we could get it funded through grant money, I think we should do everything in our power to pursue that.
I wanted to clarify too, when you're talking about procurement for an architect. So the way Cdbg and the application process works is you just need kind of a simple preliminary report that has good cost estimates and evaluates some of your alternatives, so that when they look at it, they know you've done at least the preliminary planning. So there's procurement for that. If you want that same firm to participate and actually operate, if you were awarded the grant, you need to do it according to Cdbg's rules. If you're planning to pay for the preliminary yourself, but want the grant to pay for the actual design after you've been awarded or during the awarding process, you would still need to procure that original firm as you would for the other, so they don't get excluded from trying to work on the project if you're awarded. Does that make sense? Sorry.
yeah. And I know we need to work with the mayor and city council too, so, I don't want to put the cart before the horse, so,
So we, Lincoln had drafted kind of a bullet points of who's responsible for what, since we have so many entities involved. So we had, the city had an internal staff meeting, we talked about the project, and conceptually, as staff level, sounds great. So we're going to draft, get the bullet points in order, and kind of do a back and forth before we send it to council to do a formal agreement to make sure that, all parties are comfortable. And not only that, it gives us kind of a roadmap for the entirety of the project of who can be doing what at the same time, so that way it moves smoothly.
This is redundant, but just to make it perfectly clear, the $2 million that the city is going after has nothing to do with the $2 million that the county's going after. Those are separate entities. They're not in competition with another.
Yeah.
Yeah, right.
no.
We had to figure that out, though, to be
Yeah.
fair. That was the big question that we had. And that we got a resounding, no, city can apply, county can apply, but the city has to apply on behalf.
So the city doesn't have anything else they need to apply for that would,
No, we are, with the application that we're putting together, we are pursuing the widening of Monroe Street to Capital Region, has a direct impact for COVID. So that is, and we also have it identified in our sales tax. We also have a few planning documents, housing needs assessment that we're working on, And also, the fire department, I might mess this up, it's standards of cover. It's like a strategic plan for fire. They're pursuing that as well. Hopefully it'll make everybody's fire insurance go down once it's completed. We're also putting out a request for proposals for our nonprofit agencies. So we'll have a sub-granting program, so they can do, they've been, nonprofits in the local community have been hit especially hard because they have the capability of responding quickly, whereas government takes a little bit, so we're hoping to keep them operational and going. So we'll put in a $2 million ask, but it's gonna be kind of a menu of things.
So you're putting in, are they gonna be competing against each other then for the funds?
Oh, the
No.
nonprofits? Or,
You're applying for this pot of $2 million.
So they're
all
not,
of it, right?
it's not competitive. They essentially review them as they get them for whether they check all their boxes and meet the requirement, and then do we have the money? And so it's essentially predicated on getting your application in as soon as possible. They've got applications in the hopper now. They don't have many entitlement applications as of yet. And I think there are 3 separate pots of money with this COVID funding. 2 of them are exclusively non-entitlement communities. So Jeff City would be excluded, but there is 1 pot of money that is available for this application cycle.
So if the substation took a full $2 million, then there's still other money for these other.
Yeah, I think there's $11 million spread
Okay.
across.
I thought
for
there was just
non-entitlement.
$2 million. So,
No.
It's a bite at the apple, but there's still more apple there.
okay. I'm still confused. But, hey, if we get $2 million, that'd be
Well, that's what
great.
David Bach had contacted me, he said, hey, I might have a source of funding for the EMS station. And my ears perked up, so that's when we started meeting with you, and so I want to make sure we get our application in.
You're set on location? You said a minute ago that you have an idea of the location. Are we set on that location, or?
I like that location, and I'm gonna,
What location?
pardon?
Which location?
We've had several come up, but the one that you're talking about, the parking lot down below,
Yeah. I would
that's
be-
the one that I think would fit the best, I think.
I would be
came
opposed to
across.
that,
So,
taking the parking away from.
but if we can get
Well,
some
we
more
would-
parking, would you be opposed to it?
This is where the problem is. I was thinking about this over the weekend. Leasing the property means that I'm gonna have an ongoing cost. Right now, I own, the law enforcement sales tax owns that.
Which the county owns, and we can negotiate with ourselves and make some kind of deal on
Well,
that.
I understand you.
But we can find you
I have a
more
problem
parking
with
if
that,
that, so what was the other issue then? So-
Well, the parking, that means that I'm gonna end up paying for parking now. And I shouldn't
Well,
have to do that.
we're,
So-
we're actually looking into that, John, to try to get something where you're not having to pay for parking to
Well, and I don't
make
think,
it.
I don't think that we should have to be walking very far. I mean, I don't agree with putting us up on Adams Street by the library and having my staff walk that far either.
I didn't say where it was gonna be.
Well, I know, I'm just
So-
letting you know my concerns on this, and this isn't, I mean, I've expressed my concerns on taking, especially with us looking at building out, we're gonna need more parking than what we have right now.
Yeah.
And we're gonna need that parking area, so I don't want to.
But I don't think we should hold up applying for this grant with questions like that we can address. And, you know,
Well,
even if we can't address them, then we come back and say, all right, we're not gonna take the grant money.
Well,
So-
I'm just making my notions out there to let you know that.
Why do you do that, John? Just
I
stay
would-
quiet.
I
Why
would
don't
be
you just
opposed
stay
to
quiet?
it
It was so easy
unless we
without
could-
that.
Unless we could lock down for sure that I have parking and it won't be any, because, well, I'm not concerned about, you guys would make me have, but I would get parking. I have no doubt that you would make the deal where I would. But if it's leasing, in 5 years, they could sell that building and we lose our lease, or a new commission could come in and say, we're not gonna do this anymore, you're gonna have to walk from Lafayette Street. So there's all kinds of issues there that right now I don't have those concerns. And we all know that, right now, and I'm just throwing this out because I'm frustrated with my stupid garage doors, they're broke again. And I don't know if it has anything to do with this, but I'm just gonna bring that up, they're broke again. But, I just don't want, I don't wanna add more burden to a staff that I already have issues with, hiring and retaining, and then I'm gonna have to make them walk you know, uphill both ways to come in the snow, to come to work, so.
Yeah.
Well, we bought that lot just so we would have it. So we have it, and I think, but again, I'm checking to see about some other parking for you, so.
And you're correct, sir, you know, we bought this for that specific reason, but I believe if you look at the notes, it will say it's specifically for parking for the sheriff's department. That's what it was bought for.
Yes, and it was bought with law enforcement funds.
Right.
So it is,
Didn't you initiate
I did.
acquiring that in the
I
first
did.
place?
I did initiate that. So, I think you guys were looking at it anyway, but I brought it up again, so.
Yeah.
But I'm just saying, I have concerns, so I just want to make sure that y'all, the three of you are know about that.
I just need to ask one question. I know the CBG is different with the architect's part. We're just applying for the application. If we went out on our own and did this architect drawing of what we want to submit it for the grant, is it potentially, we're gonna sign a contract without outside of the grant? So we would owe that, but we can run that back into the grant if it's approved?
You can't get reimbursed for
Okay.
architectural reports.
I thought that was
anything
part
that
of
was
it.
spent on prior to an award, essentially.
But what
prelim.
we've learned about you this morning is this architectural drawing, whatever this is, it is not so detailed that it's going to be excessively costed.
No, there's a kind of a couple page guideline, and
Right.
CDBG
Okay.
has, like, write a report that fits that. I know for engineering reports for public infrastructure projects, they're between $5,000 and $10,000. I don't know I haven't seen an architecture report on a project yet, so I can't speak to those, but it's not detailed plans for a complete design of a building.
Okay.
Yeah,
Okay.
That's not what you
Yeah.
need to
So
do.
that,
You know, this project has been on our radar for a while, and we have set aside a large pool of capital money. So if we did have to pursue architectural drawings from our capital budget standpoint, that's probably something that we could cover in the short term.
Well, and then in John's concern, I think we'd have money there to purchase other parking and not have to lease it. I agree.
yeah, I
wanna lease it,
don't plan on
Sheriff, so
leasing.
Completely
If-
understand.
if-
If that's something we could roll into the grant too, is purchase price for parking, that would, because we'd have to have it for the EMS staff anyway, so.
You can purchase property for, so I'd have to talk to CDBG about that, but generally you can only purchase property used for the construction or the.
Which we would have to
whatever.
purchase it from the law enforcement fund and.
Yeah, so acquisition is something you can actually get done.
Okay.
Yeah. Yeah.
So when do we have to work on getting a prelim plan together? Is that our next step?
I think the next step from the conversations that I've had would be to work on this governmental agreement with the city to make sure that
Yes.
those pieces are locked down.
So while you're working on the IGA though, can we be working on a prelim plan, or do you wanna say, don't do that till we know for sure we've got the IGA?
I mean, so there's a risk there of you guys coming to agreement, but I don't think much, right?
If we go on a
So you
prelim plan, it
can
gives us
actually
an
go ahead and start
idea
working on it,
whether
yeah.
this comes to fruition or not.
I think
We've
that-
got a couple other places we've looked at that if this falls through, you know.
And that can be something that can be discussed in the preliminary report, is like, hey, evaluate possibilities for these three locations that we've thought about. What are the construction costs for different, they're gonna be different, right? If you're looking at one property versus another. That can be something, and probably should be something you should consider if you don't already have a property nailed down.
I think the other piece that we've talked about is that this has been something in the long-term plan of our agency. So whether we end up getting the architectural piece and then for whatever reason we don't get funded through the grant, it's not something that this was a one-stop shop. It's still something that we need to pursue, and whether it's through the grant or in the future through our own capital improvement funds, having those architectural pieces in place, will be a benefit. So
That's where I was going with it, that
Yeah.
maybe we start with the prelim plan and we're working on it at the same time as your.
Yeah, we'll work
IGA.
with you with the city. We'll come beg the city council and get down on our knees and,
I don't
Yeah.
think that's necessary. So we're.
Sam will.
yeah. But no, I think this is still just a great opportunity. I
I
think
think
it's,
you and the mayor should go for a Corvette ride and you can just have a nice little chat then. Get your red Corvettes out there.
yeah. But anyway, I think it, potentially, I think this is a this is really good. So basically, we just wanna, yeah, throw it out there so everybody knows and give that to Nick. So,
Yeah, thank you all for bringing this up and working with us on it. Appreciate the city's
Yeah.
cooperation on it too, so.
I just, whenever I see our ambulances sitting out in a parking lot and it's colder than you know what, or it's hotter than you know what, I'm just like, and people don't understand, you know, why they are sitting there. They're not.
It would definitely be fulfilling a need. It would be a great benefit to our workforce to, you know, provide them with another nice facility to work out of. And it's also, kind of regardless of where we go in the downtown area, with the lots that we've looked at, it would maintain our standard of coverage throughout our county footprint. So we're comfortable with pursuing this project in whatever form that it takes.
Okay.
I think Rachel mentioned one last bit of housekeeping with the intergovernmental agreement. I know that there's no formal requirement for that to be reviewed by CDBG, but I don't think it wouldn't hurt to actually to get them involved once you guys have that intergovernmental agreement drafted, to have them take a look at it and if they have any concerns before it gets signed and pushed out the door. And same with procurement for your architectural report. If you plan on using CDBG funds for the final design, or versus you're going to do that all yourselves, still probably want to check in before moving forward with signing contracts or completing a bid acquisition.
Yep. Makes sense.
Yep.
Just let us know.
All right.
Yep.
If we need to schedule a meeting, get something signed, we can do it.
Yeah.
Okay. Start working on that. Thank you.
Okay. Thank
Appreciate
you.
it. Thank you, guys.
Accounts payable review.
I'd ask for approval of accounts payable pending review.
Motion to approve accounts payable pending review.
Second.
All in favor?
Aye.
Aye. Discussion of third floor cleaning, which is the prosecuting attorney's space.
Basically, we were asked to put this back on the agenda this week from last week. I know, just a report from Greg, that all the ductwork vents, they did get cleaned. Not the ductwork, just the vent thing. So we're just still needing direction from you guys as to what you want to do as far as the cleaning goes, or since then probably has come up the discussion of replacing the
Is Greg
carpets.
around here?
No, he had some other kind of meeting.
Because from when the vents got cleaned, they're pretty nasty from what I understand. And I think we need to look at cleaning the ducts, because if the vents are that bad, the ducts are probably gonna be that bad. And it's not gonna make sense to do any of this other cleaning if we're not trying to address the problem. So I need to see, figure out if there's humidity in the air that's not getting out of there, the ducts are that bad. It's not gonna change anything. We can clean it every month, it's not gonna change anything. So, the duct cleaning, I think we need to look at doing, and then if you've got a proposal from Renewal, if they wanna come and do a one-time cleaning, once we get that done, and then maybe have them come in and test the air and stuff again, see what it looks like. They were talking about cleaning the carpet. We had a little discussion after the last meeting, and somebody brought up actually replacing the carpet, because the last time we did all of this, they did not get done. And it doesn't make sense to spend $5,000 to clean some crappy old carpets up there. I mean, I think now would be the time to look at replacing them. I think we got money in capital that we could do that. I think between that, the duct cleaning, and then having somebody come in and do a good cleaning like Renewal proposed would be a good start.
I'm fine with that.
I think they mentioned too that they didn't know if they would destroy the ducts or damage them in any way by cleaning them, and that was Greg's concern too. Just so you know, that could be a possibility if they come in and did that, but it's whatever you guys want to do.
Because they clean it by a wand. So they were concerned with the wand in the ductwork and it started waving around that it could damage the ductwork if it was old. I'm not sure,
What'd the cleaning place say?
that's what they said. Or that's what the ductwork people said.
It wasn't Greg that said that.
No.
He said it too.
Well,
I
yeah,
don't know,
I
but-
don't know.
I mean, we added
I
that
haven't
whole
crawled up
floor
in the
on.
ceiling to see what kind of ductwork we have up in there, if it's all flex or if it's, regular ductwork. So apparently there's a bunch of flex up there.
I don't know. Can't answer that.
Well, and at
Well,
what point is the age of
I-
the ductwork too old to do it? I mean,
Yeah.
I'm thinking it may end up being costing more, but I think it's gonna have to be done one way or the other. And if it gets broke, just replace some of the duct that,
What is the age of the third floor? It is not that old.
No, it's when we added both sides on. I'm gonna get to that right now.
20?
I think it was 99.
yeah.
99 is when we moved in here. So we added that floor on and we added floors or out.
Right.
When this was just a 2-floor building.
I may regret saying this, but this building was built, or these additions, it's commercial, it's industrial strength property. It may have been done by the lowest bidder, but it's not like somebody worked on their cabin on the weekends, duct work. It's the real deal. I think we'll find that it was a union installed under prevailing wage contract, that 22 or 23-year-old duct work should be solid.
Yes, we bought the building in 1993. It sat here for quite some time. And then we did do the 99.
Right.
We moved in, so it took a while. It took a few years for sure.
Jeff, I think I agree with everything you said.
Okay, so-
And just to add to it, I don't have a concern about destroying ductwork. That's probably their standard caveat when they do work, because they don't want to be held responsible for nicking the inside and punching a hole in the spot.
I'd say if they start having problems, stop.
Back
Let us
off.
know and we'll address it then, and
I think,
so.
just a thought, maybe you can have Nick check into this too. Only we tell.
A week, next week.
Well, where's the ladder?
There was 3 phases when we did this place, so yeah. Go ahead, sorry.
No, that's it, I just want Nick to do it.
I agree. I think, and, you know, Sam said they don't, that's beyond their capability to do the duct cleaning. So I think we had a bid just for duct clean, do that first, and then have Radels come in and do what we want them to do. So that carpet up there is the original carpet, right? So, I even kind of agree with Jeff there. God, this is bad.
I can leave now.
But you know, you start talking about that, then I start thinking about the floors at Pringer too, because those are the original floors. But
I think
Yeah.
the order you do that in is probably kind of important. You may want to do ductwork, then carpet, then
Yeah.
cleaning, just so you get
Yeah.
all of the dirt and things that are gonna get stirred
you
up.
think?
Well, here I go, agree with Kristen by that.
Oh, every once in a
I was
while.
gonna say, I was gonna make a motion to go ahead and proceed with the ductwork cleaning with Junior's Pro Clean per their bid.
Is that a motion?
Yes.
It's a second here.
Any other discussion? All in favor?
Aye.
Um, Then, I guess we need to get some pricing on flooring, and if we're gonna do squares again, which I like the squares, cause if
Yeah.
something goes wrong, you can pull one, replace it.
Yeah.
So, I think getting new floors, Locke probably wouldn't be upset if it's,
I visited with, Locke gave me a walkthrough last week too, and actually in that, do we call that a jury room up there now, a conference room?
Conference room or break room, yeah.
Break room, because there's food consumed there, there's a little kitchenette. That area needs to be either vinyl or what do we do out at Health? Planking.
Yeah.
And perhaps that whole room,
either one.
whatever the floor covering, but needs a change from carpeting around the water and
Yeah,
food area.
so.
But yes, we
a
need,
couple
we need some,
different options, so.
we need some,
Vinyl plank.
we need some quotes on floor covering.
Yeah, VCT.
I don't know if that was what yours was, though.
You'd be better off on your own.
I just felt left out.
I don't think that was VCT over there, though. Have you seen those stuff out at the health department?
Yeah.
It's 3 foot long, either a foot or 2 foot wide.
Yeah.
Gina Green
Mine
at
was
Scruggs.
But it all snaps together like.
They glue it down.
Yeah, it was glued too, because it was same but different, so maybe that's
Just look at
still
the-
considered
look at the
VCT.
last bit.
So,
Yeah. The only other thing I'd throw in there, if you don't mind, getting a proposal, the ceiling tiles, the ones that are stained, maybe you need to think about replacing
so
those.
stain all the rest of them to match?
No.
I agree with Jeff.
Sorry, Debbie. I agree,
Just put the
yeah.
hose in.
Yeah.
We do need to replace them because they look terrible. So,
Can you
I
talk to
don't know.
Greg about that?
That's something that we can do
Get a
too,
bid.
so.
Yeah.
Yeah.
Talk to Greg about it.
Did you get new carpet?
She
Yes,
did.
I got new carpet before you did.
Okay, but we need to do duct cleaning. We need to do the duct cleaning on yours as well. And I think there's another area, there may be some water leakage that we need to look at getting repaired. You said by the door that there's some stuff maybe possibly on the trim.
Yeah, I think that door that goes out onto the roof, you may wanna look underneath that door.
Okay.
If there's some
Water damage.
water damage.
Okay.
Well, Sam said they would do as much, I mean, that's why he broke it down per hour, so he will do, and his ultrasonic line cleaning, talking to Jessica, I got a feeling those blinds probably haven't been cleaned since they were put up new, so they take them down, they clean them, they do that ultrasonic, it's not gonna be cheap, but at least those things,
We need to ask him how long he's gonna keep this quote good for though, because if that's the final stage, that might be a few months
Yeah.
out
Okay.
still. If he'll
And-
hold the quote for,
okay.
And
I
I think
can-
we need to count how many blinds, count how many chairs, and get an idea so we have a not to exceed bid. So it can be by the hour, but, we don't want to hold them.
if it exceeds it, let us know and we can talk about it then.
Yeah, because I think that was his concern, was he doesn't know until he gets in there
Yeah.
and really starts cleaning stuff, what it's gonna entail.
Well, once we get everything else done, then can we put that on the agenda to talk about a do not exceed and kind of see how much?
Yes, and we can talk to Sam too,
Mhm.
and tell him that's kind of the direction we're going ahead.
Okay, so we got a
Enough
plan,
direction,
right?
yeah.
Oh, finally, we're gonna get Matt out of here.
Yeah. Okay. Then Sam, okay. Okay, so we gave you direction. Okay. Then we will move to signing of the final change order for Old Forge Road Bridge Replacement, project number 2019-802-1.
These
So-
are good ones.
What's that?
These are good ones.
So this is the final change order for the final closeout documents for Old Forge Road Bridge replacement with Bernanke Construction. The primary reason for less work needed is a lesser amount of geotextile fabric, filter cloth, rock blanket, and bridge piling to complete the project. Overall, this change order is a decrease in the cost of construction by $5,292.
So saved money.
We saved money.
There you go. Told you it's a good one.
I will bring up the rest of them.
Hey, live in the now.
That's right.
So, yeah, I'm good with it.
Okay.
Go ahead.
Motion to sign the final change order for Old Forge Bridge replacement project number 2019-0, -802-1.
Second.
All in favor?
Aye.
Aye.
Okay. Look at that, it's not even 10 o'clock and we've gone through that. Do we have anything else before we go into closed session?
So,
Jeff?
We usually have something.
I know.
No, this, if I do, I'll bring it up after we come out of closed session. We got
Okay.
salary commission meeting I have to walk to, so.
Yeah. Okay. You want to make a motion to go into closed session?
I make a motion to go into closed session pursuant to section 610.021 of the revised statutes of Missouri. The commission will go into closed session to discuss the following: personnel issues under section 610.021, paren 13, close paren; responses to bids and negotiated contracts, section 610.021, paren 12, close paren.
Second.
Roll call?
Harry,
Aye.
Sam,
Yes.
Jeff.
Yes.
Okay. Hey, John.
Yeah, welcome.